Hello, and welcome to Everyone Dies. I'm Marianne Matzo.
And I'm Charlie Navarrete.
And welcome to our Quickie episode where we're going to want to talk about the coronavirus today.
Oh, boy. Yeah.
Charlie lives in New York City. About half of all cases in the United States are in New York State, and most of them are in New York City itself. I'm in Oklahoma City, where we have our number of cases, but not like New York. So how are you holding up, Charles?
I'm fine. Actually, now it's over half. I haven't looked at the numbers since yesterday, but as of yesterday, it was over 53,000. It was over 53,000. So I don't know how much more that's gone up today. Basically, just hunkering down in my. In my apartment. I venture out to go grocery shopping, but I avoid any big box stores. Simply go to some local bakery. Actually, local bakery sometimes, but just a small store. Pick up a few groceries. The prices are a little more expensive, but it's worth it because there are less people there, and I notice the staff just walking around and cleaning things. So. That's it. And then I just come back home. And wash your hands. Oh, yeah, yes. And it's funny. I've even started to take a shower sometimes if I'm out. If I'm out, and then I decide, because the streets really are pretty empty here. Mm-hmm. Decide, you know what? There's not a lot of people around. Let me take a walk while I'm out. So I will do that. Mm-hmm. When I do that, when I take a walk, go to the grocery store, and then go home, I will take a shower and actually change clothes. I won't, after I shower, I don't get back into the same clothes.
Well, all these good hygiene tips. Thank you, Charles.
You're welcome, Marianne.
I'm writing all of this down. Change your clothes after you take a shower.
Yeah.
Well, my concern, and the thing that I wanted to talk about today, was the coronavirus and the deaths, and less so the death rate, which is about 1% or so, depending on where you are, but more about what's going on in terms of how people are dying.
And I'm sorry to interrupt, but when you mentioned the death rates, like depending where you are, I'm sorry, in roughly 24 hours, death rates have gone from 1,000 to 2,000. I mean, they've doubled.
Well, that's relative to how many people have the virus. So when you look at looking at death rates are per the number of people who have the virus.
Okay.
And so it's not how many are dying in a 24-hour period. It's how many are dying relative to how many people have the virus.
Got it.
Yeah.
Okay.
Yeah. So what's happening, though, in the United States that I'm finding really concerning and actually really upsetting is that the planning for an epidemic or pandemic or a disaster has really been lagging in the country. Back after Hurricane Katrina, that was really the first time in our country that we had a disaster where the number of people who needed help and the supplies and the things that we needed were not available to help them. So, 9/11, for example, there were a lot of people available, a lot of supplies available, but no survivors. The Oklahoma City bombing was the same situation. We had enough resources, but we did not have enough survivors to take advantage of those resources. So, Charlie, what I really wanted to talk about today in our Quickie chat was how people are dying with this virus. We are in a situation where people are dying alone because of our lack of preparedness for a pandemic. And you think, well, do you really plan for things like that? And the answer is yes. Yes, we do. As a nation, as a government, we plan for things like that. And there's an Office of Preparedness that does that. Really with Hurricane Katrina is when a lot of the planning started. Mm-hmm. With Hurricane Katrina, there were a lot of survivors who were in need of medicine and physical care. There were a lot of deaths. And so there was this question of, so what do we do with bodies? After that happened, the Institute of Medicine did a planning group. And the idea was, what do we do if we have a mass disaster or a pandemic where we have more survivors than resources?
Okay.
So the idea being, if there's scarce resources, what do we do? And to prepare guidance for communities to say, here, we got these experts together on disaster planning and are saying, here's the information. Here's what they were able to pull together to give guidance to communities so that you can plan, if there's a disaster, what you would do. And this was after Hurricane Katrina.
Okay.
So Katrina was really the first disaster, really since the Civil War, where there were more survivors than resources. 9/11, there were a lot of resources. There were hospital beds, right. There were bandages, medicine, healthcare personnel. And if you look at those pictures from that time, those people were standing, waiting for survivors to come so they could help them.
Right.
But there weren't the survivors.
Yeah.
Oklahoma City, the bombing. We had plenty of hospitals, plenty of resources, but not the survivors. So Hurricane Katrina was the first time there were all of these survivors, and there wasn't enough medicine. There wasn't enough of anything to help these people.
Why not? What happened?
Well, they were in a section of the country where it was a low resource environment. Mm-hmm. Resources were sent into to the airport, and a lot of things didn't get very much past the airport because the areas in those surrounding areas took the resources and utilized them, so they didn't make it all the way to New Orleans. Oh. The planning that they did was insufficient. Like in one hospital, they had 2 generators, and per how the law worked, you had to turn that generator on, and you had to run it for 30 minutes, and that was how you made sure your generator worked. Well, that wasn't the case in Katrina. Those generators had to run for a long time. One of the generators ran out of fuel, and for whatever reason, nobody knew what fuel was needed for that generator. So they put fuel in. It was the wrong kind of fuel. It broke down the generator, and instead of having the 2, they had 1. So it was like the resources they had were not enough. They were older supplies. They weren't able to get them to the people who needed them. It was just a cluster mess of a situation. And so through the government, people were brought together to say, okay, if we're in a situation of a pandemic or a natural disaster, what is it that communities need to know so that they can make their own disaster plans based on the culture of the area of the country, the beliefs. Like I was on this plan, and I had been living in New Hampshire, which at the time, this was in, I think, 2007 or so, at the time was like one of the number 1 places in the country for cremation. And I had said, well, when they're talking about, well, what do we do with all the bodies? Well, couldn't there be a plan where people would be cremated, and then, the cremains stored for after when people would be able to bury them. And they'd be like, where are you going to find so many crematoriums? Well, in the city I was from in New Hampshire, there were like 6 within the same city. I'm like, well, that might be true there, but in other parts of the country, you'd go pretty far before you'd find a crematorium.
And then what about if, some people don't like crematorium, don't want their loved ones to be cremated, buried. It seems that then things are being imposed on people without considering what some people might want.
Well, and that's why you say to the community, all right, if we're in a situation of a mass casualty, a bombing, a pandemic, what are we willing to compromise on? What might we need to have to do just to manage? They might say, well, then we need to get a refrigerated vegetable truck and put the dead bodies in there and keep them cold until the disaster passes, and then pull those out and say, okay, we're going to bury them. Every community has to make that decision for themselves in terms of how to respond. What was given and what's available through the Institute of Medicine is the guidance for here's the stuff you need to think about. Here's what would be needed. In the past, up until Katrina, if you were black tagged, meaning you're going to die, there's nothing that we can do to save you, they would be moved to a black tag area and left alone to die alone.
Wow.
And my role on this committee was palliative care. And I said, no, that's not a humane way of dealing with this. Yes, I understand you have to be able to address and try to cure or help those that have the possibility of survival. And yes, I understand that there's always going to be a group that doesn't have the possibility of survival. But as a civilized or humane country, we can do better than, okay, put them over there in that parking lot. Those are the black tag people. And, when the refrigerator truck comes by or whatever, we'll put the bodies in there. We can do better. And so that guidance also addressed the palliative care issues. It was the first time that was a piece of it that was brought into what is it that we're going to do. And what's missing in the coronavirus now is that humane aspect. And let me tell you why it's happening. Nurses and physicians, healthcare practitioners are going into these hospitals all across the country. And because of a lack of planning, they're not given adequate PPE. It's personal protective equipment, the correct kinds of masks, the gowns, the gloves to protect themselves. And if you read or listen to the news stories, what I've been hearing is, well, that's what you signed up for. You're a nurse and that's what you signed up for. No, that's not what we signed up for. We signed up to care for people in their most vulnerable times, not to go all Rambo and say, oh, just give me a bandana and I'll put it across my face and I'll go in and take care of people with a very highly contagious airborne disease. No, nobody signed up for that. We expect the hospitals that we work for to give us the equipment so that we're safe to go in and care for people. Now, through a lack of planning, rotating of the national stockpile, what's being given to nurses are expired masks, if they're even able to find them, issues regarding being able to even purchase them. And, initially here's what you're supposed to have when you have these droplet kinds of precautions, because this virus is spread by the droplets that come out of people's mouths, out of, when they sneeze, that kind of thing.
Right.
That's how it's passed between people. And so you have to have the right PPE, the right protective equipment when you're going in and caring for these people, especially when you're doing procedures like intubating them, putting a trach in, doing suctioning and all of that care that, because this disease is attacking the lungs, is requiring that level of care. All right.
Yeah.
So for a while, there was this whole thing about, I think it was Joanne Fabrics or one of the fabric stores was cutting out the fabric and giving all of the pieces to anybody who wanted to come by and pick them up so they could go home and sew masks for people.
Is that a mask?
Excuse me?
Yeah.
Excuse me? You want us to wear masks, with puppies on them or whatever, and call that PPE? I went wild in my brain when that happened. There are studies upon studies that show that doesn't protect you from anything. There was a nurse in New York, mid-40s guy who had severe asthma, but was still going in and taking care of patients. There were pictures of them wearing garbage bags as PPE. He died last week caring for patients. Nurses, nurse practitioners, physicians in this country are dying because they are getting this virus, and they're getting the virus from the lack of appropriate PPE. So there's that part of my quickie rant. But let's take it to the next part of the rant. The next part is, because we don't have enough PPE for the healthcare practitioners who are going in to take care of these people,
right,
we also don't have enough PPE for visitors or anybody else to go in and be with people who are dying. So if you go into a hospital, if you go into the emergency room, you have to say goodbye to your loved one. They can't go to the floor with you. They can't stay with you. There's two exceptions. One, if you're giving birth, and Charlie, if you're giving birth, please let me be the one to be there. So if you're giving birth, you can have one person with you while you give birth.
Actually, now you can, but up to, I think, even just 3 days ago, no. Yeah, I mean, that just recently changed.
Well, it was, and then maybe it went back, and this whole thing is going to be very fluid.
Yes. Yeah.
The other is if you're in pediatrics and your child is sick, either mom or dad or whoever, one person can be designated to go and be with that child. But once the one person's designated, they don't leave and not somebody else swaps in. No, one person. So if mom is the person who's going to go in, dad, you're not going to get to go back in. So those are the two exceptions. So if you get extreme, very, very sick with this virus and you're in the ICU and you're intubated, meaning you have a tube down your throat or they do a trach and they put it right into your trachea, and you're on a ventilator, on a respirator so that you can breathe, and it looks like you're not going to survive, nobody can come be with you. They're trying to get iPads for people so that at least family members can talk to somebody. But if you're intubated, you can't talk. So you might be awake enough to see them and maybe to hear them, but there is nobody to hold your hand. There's nobody to wipe your brow. There's nobody to whisper to you it's okay. I'm here. You're not alone. And that is where we are in this country right now in terms of how people are dying with this virus. And it's not because, it has to be that way. It's because we don't have the PPE to let somebody else in, let a family member, a loved one in to be with that person. Now, is there an alternative? I think so. I think that, we have a huge population of retired doctors and nurses in this country. One of our suggestions that we offered when we were doing this IOM report is to have a black tag team. The people who will be with people when they're dying. And that there is a volunteer corps, just like you have volunteer, I'm part of the volunteer corps in Oklahoma. I've been vetted, I've been trained, I have my credentials, and if there's a disaster and I'm needed, I can volunteer and go in. If we had prepared and said, if we're in a situation where people are dying, we could have a black tag team. These are the people who have volunteered to be the palliative care people for people who are at the end of their life. That would be able to go in, and you'd have PPE for, let's say, one volunteer black tag person in an ICU whose job it is to go to all those people who are dying and hold their hand and talk with them. They're, like I said, they're on a ventilator. They're not going to be talking back. Mm-hmm. I read an essay from a physician the other day who said, I'd like to be able to say I'm going to be able to hold people's hands and talk to them. But the reality is I've got people I have to intubate. I've got the actual physical care that I have to go, to treat people. I don't have time to stand there and hold hands. And the other thing he said, which was very, very honest, was, and I'm also scared to do that. I don't have the adequate equipment to be in a room any longer than what I need to do to care for that patient. I participated in a phone call the other day with Center for Medicare and Medicaid Services. And they were talking about, there was a nurse who was talking about how their nurses have their masks that are meant for one use. They wear them the entire shift, put them in a brown paper bag, and reuse them the next day.
Yeah, that's become a huge issue here.
They're not meant for that. Right. They're not meant for that. They're not effective that way. Nurses are putting themselves in jeopardy. There are nurses who are sending their children with their parents or with another family member, and throughout this entire epidemic are not seeing their children or their family because they don't want to pass anything to them. There's one physician who, when he comes home at night, sleeps in a tent in the garage because he doesn't want to pass the virus to anybody, because he knows, and these nurses know, they're not protected. But every day they get up and they go. And then these people, the people that are dying alone. And I got to tell you, Charlie, I'm so distressed by this. We can do better. We should be doing better. And and I don't fault the nurses and I don't fault the doctors. They're doing heroic things with, masks with puppies on them. This is insane.
Yes. So what can be done?
It's like the horse is out of the barn and he's in the next county. What the hell are you supposed to do now? They're trying to manufacture the PPE. People are getting creative with plastic and headbands. But I've spent a lot of time in Russia teaching and in their hospitals and in their aid centers, and it's like, are we rivaling a third world country? It's healthcare now in New York City? I am appalled beyond words. And, I don't know if you heard this, Grey's Anatomy donated their masks and PPE.
Right.
that they use
Grey's
on their show.
different like medical type shows. Yeah. That, yes. Yeah.
So I think that they're doing what they can do to rustle up as many supplies as they can. The supplies that they're getting out of the national stockpile are expired.
Right.
But
and you know what? I know what you mean by national stockpile, but what exactly is the national stockpile? So
we have, for lack of a better explanation, imagine that there's a warehouse, somewhere, and then it has masks and it has medications and it has oxygen tanks and it has ventilators, respirators for people who can't breathe. They're stockpiled, they're put away, they're hid. They're like when my mom was, around and we were kids, she would stockpile the candy and the cookies someplace where we couldn't get it. So that if it was really
a analogy, that's it. Yeah.
If there was a real desperate situation, they could get their hands on it. We can get our hands on some ventilators, but only as much as we've stockpiled.
But the thing with that too, my mom used to do the same thing too with candy, especially around Halloween. And then we thought the candy was done. My mother would forget about it. And then 3 or 4 months later, in the middle of winter, hey, look at all this candy. My sister and I would take a bite, and it was just not good anymore.
Right. And that's what's going on with, because things expire. You have to rotate your stock, right?
Exactly.
In any grocery store or whatever, you have to rotate your stock. Now, if you were really, really starving in the middle of winter with that candy from your mom, you'd say, all right, I'll choke it down because there ain't any other candy. It's not the best, but I'm jonesing for a Snickers, right?
I imagine you can't do that with a mask or an out-of-date respirator.
Well, you do it. They're doing it with the masks because even though it's expired, there is no other alternative. The other alternative is the cloth mask with the puppies on it. So yes, they're using the medical equipment that's expired. And I can tell you, there were so many times that I would see, they would go through at the end of every month in the system that I worked in, they'd look see like what wipes were expired, and they would throw them away. They would throw syringes away. Nothing in them. They were plastic syringes, but everything had an expiration date on it, and they would literally throw them in the garbage. And I would look at that and I think to myself, oh my God, the hospitals that I saw in St. Petersburg would love to have these. Nursing schools would love to have these, as practice things. You throw stuff like that away. But those were the rules. Those were the JCAHO rules, the governing bodies. It's expired. You have to get rid of it. You can't have an expired syringe. Where, here we are in this situation where we don't have enough resources. We're in a pandemic, and you're thinking, God, the pounds of equipment we threw out because it was expired. As a country, this is going to need to be a wake-up call to say, you don't know when this is going to happen again. Our last pandemic flu was 1919.
Right.
So every 100 years, maybe we need to plan for a terrible flu. But if it's not a flu, it could be anything.
Well, yeah, I mean, that's the thing. In the past, what was it, 15 years or 20 years? We've had, SARS. And what was the other big one?
Ebola.
Mm-hmm. Which, was, and I feel bad for Africa, but it's basically limited to Africa and in specific areas because it's not, small villages and towns are not global cities.
Well, and I think that was part of the issue with Katrina. It was like, well, that was one city of a minority population. And, even when they were evacuated, like to Texas, wasn't it Barbara Bush who said, they can't be staying here, send them back to Louisiana. And it's, it didn't affect Tom Hanks, or I just saw as we're talking that Joe Diffie just died from the coronavirus.
I'm sorry, who?
Joe Diffie. He was 61. It just popped up on my phone while we were talking.
I'm sorry, I'm not familiar with him.
He's a country singer.
Oh, right. Yes. Yeah.
Our age. 61.
61, yes. Yeah.
So this is in my opinion, a deplorable situation that we're in. We're in it because of our lack of planning. Mm-hmm. And I can only hope that when we come out the other end, when the curve starts to flatten out, and that we have some good hard looks at how do we plan for disasters, because disasters happen and they don't give you warning. You have to plan and have your stockpile and have your policies and your procedures ready so that when they happen, you can step in and take care of people.
Yeah, you're ready. Right.
Right. So on that happy note, I hope everybody who's listening is staying healthy. I hope the curve flattens soon. And I hope that we do better in the future, because nobody should die alone.
No.
Thank you all. Good night.
Be safe.
This podcast does not provide medical advice. All discussion on this podcast, such as treatments, dosages, outcomes, charts, patient profiles, advice, messages, and any other discussion are for informational purposes only and are not a substitute for professional medical advice or treatment. Always seek the advice of your primary care practitioner or other qualified health providers with any questions that you may have regarding your health. Never disregard professional medical advice or delay in seeking it because of something you have heard from this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Everyone Dies does not recommend or endorse any specific tests, practitioners, products, procedures, opinions, or other information that may be mentioned in this podcast. Reliance on any information provided in this podcast by persons appearing on this podcast at the invitation of Everyone Dies or by other members is solely at your own risk.